So my PhD is focusing on the role of inflammation, and specifically inflammation excessively over time, called chronic neuroinflammation in the brain in frontotemporal dementia. And I'm particularly interested in inherited or familial FTD. The reason for this is that progranulin, which is one of the three main genes that causes familial FTD, has been found to be associated with inflammatory pathway regulation. And there's increasing evidence that perhaps patients with mutations in progranulin who have frontotemporal dementia might have excessive inflammatory markers in blood or spinal fluid that we can then use to study what causes the disease. So my PhD is looking at whether there's evidence for that in blood and spinal fluid that I collect from patients as part of a couple of studies at UCL. One is the Genetic Frontotemporal Dementia Initiative, which Jonathan Mora heads, and the other one is the longitudinal investigation of FTD that studies the sporadic disease. So that's also going to cover patients who are people at risk of developing the disease, who are what we call pre-symptomatic. These are people in their 30s or 40s who are at risk of having the same mutation but don't yet have symptoms. The second part of my project is also looking at other markers of inflammation in the brain, such as microglia. Specifically at the Queen Square Brain Bank, we have a large collection of patients who died and donated their brains, and I'm looking at microglial activation markers in different regions of the brain. So the idea is to find perhaps differences in the sporadic versus familial forms that we can relate back to the proteins that build up in those cells, the pathologies, perhaps guide us towards whether anti-inflammatory treatments might be helpful for some of these disorders, particularly, for example, patients who carry the progranulin mutation.